I'm Becki Jennings with Jennings Insurance Group in Osage Beach, Missouri. I'm also a co-owner of KeyEstateDocs.com, where we help people work through the process of estate documents like medical directives and powers of attorney. I've been working with Medicare beneficiaries through 17 annual enrollment periods. So I've been watching the Medicare space for a very long time. And word on the street is this will be the most disruptive year for Medicare beneficiaries since Part D, prescription drug coverage, was introduced in 2005-2006. The additional scuttlebutt is this. Typically, about 15 to 20% of Medicare beneficiaries will typically shop their plans each year. This year, we're expecting closer to 70% of Medicare beneficiaries to shop plans. In today's presentation, we're going to discuss the Inflation Reduction Act and the impact it will have on Medicare beneficiaries in the coming months. Once a law is passed, there are regulations that follow. These are Medicare's final rules on the Inflation Reduction Act, and we will discuss Part D changes. The Medicare Prescription Payment Plan, key changes to the TROOP, which is the true out-of-pocket costs, and creditable coverage when you are on an employer plan. On August 16th, President Biden passed the Inflation Reduction Act, causing big changes to all types of Medicare plans. The Part D changes, they will affect standalone prescription plans, Medicare Advantage plans that include prescription drug plans, and a few other things as well. So changes actually started in 2023, and they will continue until 2032. There are four things that you need to be aware of for January 1st of 2025. First of all, we will be getting rid of the donut hole or the coverage gap. Now, I know some of you are saying that the coverage gap was supposed to go away a few years ago, didn't really happen. This year, it really is going away. And so we're going to talk about that as well. There's also going to be limits on out-of-pocket costs, and the limit on out-of-pocket costs for your prescription plan will be $2,000 in copays and co-insurance. And I'm going to explain that here in just a minute. All plans must offer prescription payment plan options. This is going to be a little bit involved when we go through and talk about that. And Part D plans and Part D plan sponsors. So the insurance companies and the manufacturers must cover more of the prescription drug costs than they were covering previously. For 2025, let's compare 2025, and then we'll talk about 2024 as well. But for 2025, Part D plans now have 3 stages or phases. The first phase is the deductible, and that deductible will be $590. Now, not all plans have deductibles. It's specific to your plan, but Medicare's basic plan, basic benchmark says the deductible can be as much as $590. Then we have the initial coverage phase, and this is where the member pays 25% co-insurance on covered drugs, so drugs listed in the formulary, until the member pays $2,000 in copays and co-insurance. And then the third phase is catastrophic. And what that means is once the member has paid $2,000 toward prescription drug costs, there is no more cost share for the member. So you will pay no more after the $2,000. One thing to note, please know these drugs must be on your formulary. So it's not a prescription that's not on your formulary and you've paid you paid full price for it. These are just prescriptions on your formulary. So let's do a little bit of comparison between 2024 and 2025. The deductible in 2024 was $545. For 2025, this upcoming year, we're looking at a $590 deductible. The initial coverage in 2024 worked like this. The member paid 25% roughly co-insurance after they paid their deductible up to $5,030. So once the member paid that amount, then that was what was required during the initial coverage phase. And then you were in catastrophic at that point. And at that point, you paid zero. Now, previously, before 2024, so 2023 and prior, when you would hit catastrophic, you would roughly pay about 5%. There was some other co-insurance in there too, but just to give you a comparison and explain to you that some things have already begun to happen with the Inflation Reduction Act. So in 2025, the member will pay 25% up to $2,000 total cost share. And then again, just like for 2024, in catastrophic, you will pay nothing once you reach the catastrophic phase. And remember, when we're talking about these costs, we're talking about prescriptions that are covered under the plan, not something you've paid for, not something you bought from Canada. This is just formula on your formulary, those prescriptions that you've gotten at the pharmacy. Now, this year, this is a new thing, and I'm going to say it's going to take a while to get this implemented and running smoothly. So you'll want to be prepared for this if you fall into this category. This is called the Medicare Prescription Payment Plan. This is new. So Medicare beneficiaries can pay for their prescription monthly rather than all at once at the pharmacy. And so now bear with me because I'm going to explain this to you. Think of this as level pay with the electric company. You can pay the insurance company a set amount each month to cover your prescriptions over the course of the year, and then you're not going to pay anything at the pharmacy. There are guidelines. Not everyone qualifies for this payment plan option. So you must fall into the guidelines to qualify. And again, not everyone is eligible. The program begins January 1st. You will not be able to sign up for it until then. Okay, so you can make multiple changes during the annual enrollment period. And the last change that you make is the plan you have starting January 1st. For this reason, you're not going to be able before January 1st to get started on this payment plan. So they will not set you up onto this until the plan has actually gone into effect after January 1st. This is only for people who have high cost prescriptions, and you will want to talk with your agent to see if you qualify. This will not reduce the cost of your prescription plan. It will only spread out the cost over the year. In other words, rather than having to pay your full deductible on month one, if you qualify, you could spread that along with your copays or co-insurance over the course of the entire year. The payment plan is optional. So typically to qualify, you're looking at having at least one prescription costing more than $600 per month. Okay, so let that sink in for a minute. This isn't what you pay. This means the total for that particular prescription is $600 retail. That is a trigger that can help you qualify for this payment plan option. So if the enrollee or the Medicare beneficiary faces cost sharing of $600 or more for a single covered prescription drug plan, so it has to be on your formulary, and has not opted in for the program, the Part D sponsor, also known as the insurance company, so the insurance company will notify your pharmacy. And then your pharmacy will notify you. So if you qualify and you haven't set it up, what's going to happen is the insurance company is going to tell your pharmacist, and your pharmacist will let you know. So you can opt in or out anytime. So this does not cover Part B drugs, and so for example, chemotherapy and infusion drugs are not included in this. But again, you can opt in or out anytime. I want to circle back around to that and make sure that I'm very clear on that. So if you don't start it January 1, and let's say you get a new drug in March, or you realize that maybe this would be a good option for you a couple, 3 months into the year, you can still opt in. So once opted in, the insurance company will pay the pharmacy over the remaining months. So you won't pay anything at the pharmacy the rest of the months. The insurance company is going to pay, and then the beneficiary will not pay the pharmacy, they will pay the insurance company. So for example, if you have a deductible of $590, rather than walking into the pharmacy and paying your $590, if you are set up on the payment plan, you could be paying the insurance company, who then spreads that out over the course of the year and pays the pharmacy on your behalf. Let's talk about employer coverage, because we do have several people who choose to continue to work once they're eligible for Medicare, and they remain on their employer coverage. So there's a few rules about that. The employer plan must be as good as original Medicare. Okay, so Medicare has rules about this, and it's this part hasn't changed. It must be as good as original Medicare. Every year moving forward, the employer must give a notice of creditable coverage, a form, to all Medicare eligible employees, stating that if your plan is considered creditable for 2024, if it has been creditable for 2024, it will likely be creditable for 2025. Okay, so let me say that again. You're going to receive from your employer a notice of creditable coverage. Why is this important? Because if your employer coverage is not considered creditable, you could be subject to a penalty down the road, which we'll talk about. So all Medicare eligible folks are required to have prescription coverage or face penalties down the road. These penalties last a lifetime. Really, about the only way that you can get out of that penalty is if you qualify for limited income subsidy help or Medicaid, something that's giving you extra help with regard to that. But currently, there are no exceptions to this rule. So how do you prepare? You need to have an annual review of your prescription plan. You will want to discuss your specific prescriptions and your preferred pharmacies. Just because a prescription has been on your plan in the past and your pharmacy has been preferred doesn't mean it's going to be the same for 2025. There's a lot of speculation about what's going to happen with these plans, meaning maybe we might see fewer prescriptions on a formulary. So your drug maybe has been covered for the last several years and may or may not be in the years coming. So please, I cannot stress this enough. Make sure you're checking this year. You can change your plan during the annual enrollment period, October 15th through December 7th. And your agent can discuss your plan changes beginning October 1st. If you miss this enrollment opportunity, unless you qualify for a special enrollment period, like you moved or something like that, you cannot change your plan after December 7th. So it's very important that you check this year more than any other year. Frankly, this is the most disruptive year that we've had since 2006. And I mentioned that at the beginning of this presentation. So if you think that you've got a prescription that's maybe been a little expensive, or it's an unusual prescription that's not always covered in every formulary, those are all things that would make me say, man, I really need to check my plan for next year. So thank you for listening to this important information. If you would like to schedule an appointment with one of our licensed agents, you can call the number on this slide. You can send an email. We'll get you set up. And if you want to receive up-to-date information with things that are going on legislatively or with your plan or with Medicare in general, you can follow the agency on Facebook, TikTok, and YouTube. Thank you.
And it looks like we had a couple questions come in.
Okay.
First one is, isn't getting rid of the donut hole a good thing?
Well, it depends on who you are, because getting rid of the donut hole, the speculation is we're going to see an increase in the cost of those prescription drug plans. So, in other words, The average cost of a drug plan this year is $36. The speculation is that those prescription drug plans are going to double or even triple to compensate for what's happening. So most people are going to see potentially a significant increase in the cost of their monthly plan because we have to pay for this program.
What happens if I miss a payment on the payment plan?
If you miss a payment on the payment plan, there is a bit of a grace period, but it's only going to last for a certain period of time. And then you'll have to start paying then at the pharmacy.
If I have the prescription penalty already, will it change for 2025?
So if you're being penalized currently for what I think this person is probably referring to is the late enrollment penalty. And that means if someone has, for a period of time, not had prescription coverage, and then they sign up for prescription coverage, Medicare through Social Security will penalize them for not having a plan. And so it's based on the average cost of a drug plan, 1% of the average cost of a drug plan. So if drug plans this year, the average cost was $36, it was based on 1% of the average cost of that drug plan. However, if we're going to start seeing the average cost of drug plans increase significantly, that late enrollment penalty will go up. It's still going to be 1% of the average cost of the drug plan. It's just the average cost of the drug plan is expected to increase considerably.
And the last one that came in, will all of my drugs be covered in 2025?
So there's no one can say yes. Just to be clear, it depends on your formulary, and that's why you have to check your formulary because this is the way it works. Medicare says here's all the categories that prescription plans, meaning that insurance companies have to have prescriptions in, and they have to have at least two in each of those categories. Now, traditionally, we've had a lot of categories that'll have 8, 10, 12 prescriptions in that category. Well, if we begin to see formularies shrink, it may mean that your prescription may not be in the plan for next year. And that's why this year is such a vital year to check your prescription plan. I hope that answers all of your questions. Again, if you would like to reach out to our office, you can reach out to us at info@jenningsinsurancegroup.com. We also have our phone number is 573-693-9443. We're happy to visit with you. We do appointments by phone, by Zoom, or in person. So feel free to give us a call and speak with one of our licensed agents.